One of my biggest pet peeves is when I'm having a conversation with a patient and I give a recommendation and they tell me that they read something different on the internet or they saw something different on the internet. The internet really is a blessing and a curse. There's so much information, which is so great, but you have to know how to use it, and that's where having someone help you interpret it is really, really important. For example, people will look at procedures that are done online and see experiences that patients had, and they might not know how to interpret it because the procedure they're going to have might have a variation to it, or they may have something about themselves that makes them likely to have a different experience, or their surgeon is just telling them something that's flat out different. And it can be very difficult to change your ideas if you saw something. Seeing something online or in print, we're trained to think, well, that must be truth. I strongly suggest that whatever you read about, take it with a grain of salt and remember a couple of things. If you don't know who wrote it, where it came from, what their training is, and who it was meant to be applicable for, then you're really just sort of taking it for what it's worth without really putting it in context. That's number one. Number two is, remember also that people are more likely to talk about bad experiences than good experiences. Because when you're upset, you want to complain. When you're happy, you don't want anyone to know you had surgery and you tend to just kind of go on with your life. So be mindful. Use the information, take the information. The best way to use information from the internet is to take the questions that it gives you and bring them to someone who you trust, who's properly trained, with whom you have a relationship, and let them give you the actual scoop on those issues. Let them tell you how it's relevant to your case in particular. Let them sort of dispel the myths. And remember, Dr. Google does not have a degree.